Health Watch this morning. September is Atrial Fibrillation Month, and according to the American Heart Association, over 12 million people will be projected to have AFib by 2030. So what exactly is this heart condition? What are the symptoms, and how can you lower your risk? Joining me now to answer all of this is Dr. Suneet Mittal, Director of Electrophysiology at the Valley Hospital and Chair of the Cardiovascular Service Line for Valley Health System. Good to see you, Doctor.
Good morning.
In plain terms, can you please explain what exactly atrial fibrillation or AFib is, and why does it pose such a health risk?
Absolutely. Atrial fibrillation is a very common arrhythmia. As you mentioned, almost 12 million Americans will suffer from it. It's an irregular heart rhythm that causes the heart to beat irregularly and often rapidly. And although many patients have no symptoms, it is not uncommon for patients to report symptoms such as palpitations, chest pain, shortness of breath, and fatigue, and it can be associated with many serious consequences such as congestive heart failure and even stroke, and that is why we take this arrhythmia so seriously.
And we've heard that AFib is becoming an epidemic. Why is that? Why are we hearing more now about the condition than before?
Yeah, I believe there are three main causes for that. First, as we know, atrial fibrillation becomes more common as people get older, and we're living to a much more older age now than ever before because people are living healthier and we have much more medical treatments available for them. The second is there's no question that there's a major correlation between obesity and atrial fibrillation. And as you well know, we're in the midst of a major obesity pandemic in the United States and worldwide. But the third thing is that we're detecting atrial fibrillation. Almost everyone now is walking around with a smartwatch to monitor their heart rate. These devices are also capable of detecting rhythm disturbances like atrial fibrillation. And so there's a lot of early detection of this arrhythmia. And when you put all of these together, it seems like atrial fibrillation is commonly being heard and people know about this condition.
What is it that is putting more people at risk?
Yeah, so I think that obesity is definitely a common risk factor. It ties into conditions such as high blood pressure, diabetes, poor sleep patterns, and even sleep apnea, poor levels of physical fitness. And I think all of these are major risk factors for developing atrial fibrillation.
And what are ways people can reduce or prevent AFib?
Well, I think that there are two ways that we're thinking about it. The first is from an early age, before you've ever had atrial fibrillation, showing people the importance of regular physical exercise, the importance of weight control, making sure that they are managing their blood pressure, their diabetes, avoiding excessive alcohol intake. But once patients have developed atrial fibrillation, not only do we continue to advise them to modify these risk factors, but we're increasingly asking them to get treated for atrial fibrillation. And now there's some really nice novel therapies for atrial fibrillation, new technologies for catheter ablation, which can treat atrial fibrillation, one of them being something called pulsed field ablation.
Dr. Mittal, we really appreciate your insight. Thank you so much for joining us.
Thank you for having me this morning.